Hello everyone. Today we felt the need to share a video about an unpleasant topic because in the last 2 months, a lot of cases have started coming to the clinic, and that is dental trauma. Now, we divide them into 2 categories, primary teeth trauma and permanent teeth trauma. But today I want to talk about permanent teeth trauma. I want to talk about the trauma that occurs after the permanent teeth emerge, which happens after the front teeth are replaced around the age of 6 or 7. Now, as you know, children are very active. They fall, they collide, and they can hit their teeth on one another. While the severity of the trauma is very important here, I want to roughly divide it into 2 categories. Small fractures, what we call partial fractures, are traumas we can easily restore in our clinic, either with composite materials or by directly bonding the broken piece back onto the tooth if it's brought to us. Then there are cases where the tooth is displaced within the jawbone, and in some cases, the tooth is knocked out. If a tooth becomes mobile within the jawbone, we stabilize it in the clinic by connecting the teeth with a wire and monitoring them. If necessary, we may need to perform a root canal treatment on the teeth afterwards. There are also situations where the tooth is knocked out completely. In this case, of course, the situation is a bit more serious, so there is significant bleeding in the mouth, significant bleeding on the lip, so families often don't realize the full situation. It's realized later that the tooth has been knocked out. First of all, it's very important that we look for the tooth. I mean, the patient needs to come to us within 2 hours. We say a maximum of 6 hours here. When bringing the tooth to us, the way it's brought is very important. It can be in milk or in water. At worst, it should be brought inside the patient's mouth, in their saliva. We absolutely do not wash the tooth. If it's dusty or dirty, do not wash it with a napkin or underwater. Bring it without washing it at all. This is very important. With immediate intervention, we can reposition the tooth, stabilize it, monitor it, and we can save the tooth. Now, in some cases, they can't find the tooth, for example. In that case, the situation becomes very complicated. Please look for the tooth first. If you encounter such a situation, please see a dentist immediately.